Isabel from BSN2B, and for today I will be performing the female and male urinary catheterization into the urinary bladder using an indwelling Foley catheter. Now the goal of this procedure is to safely introduce the catheter into the bladder of the client to promote urine drainage. So for my equipment, I will be needing a sterile catheterization kit, and the sterile catheterization kit has the following. So we will have a sterile gloves, sterile drape, the catheter or the type of the catheter we will be inserting. It might be straight or indwelling, refilled syringe with sterile water, lubricant, antiseptic solution, cotton balls, forceps, urine bag or drainage bag, and the waterproof pad. So for the procedure, I will first assemble my equipment and I will be performing hand washing and hand hygiene. And after that, I will be introducing myself to the client and verify the client's identity. This is to establish rapport and to verify if I am giving the proper care to the proper person. And also I will be explaining the procedure, why is it necessary, and how the client can cooperate. And I will be discussing any allergies with the client, especially with iodine and latex. So good morning, ma'am. I'm Isabel, your student nurse for today. May I know your name? Okay, how about your age, ma'am? Okay, good. So for today po, I will be inserting a catheter into your genital area. Will that be okay? This is to promote urinary drainage po, ma'am, and this is based on your doctor's order. Is that okay? Okay, ma'am. Thank you. So may I ask if you have any allergies? How about for iodine or latex? Okay, none. That's good. Then after that, I will now provide an adequate lighting. This is to have or to provide me a clearer visualization of the area once I start the procedure. And in adequate lighting, it is recommended to have an artificial lighting, usually such as a perennial light. But if we are going to use a perennial light, we should have someone to hold it for us. And then after that, I will now provide privacy for my client. So I will be closing the door of the room and the curtains around the bed. Now I will be assisting my client in a proper position when doing the catheterization. So for female client, it should be dorsal recumbent position with knees flexed and the feet 2 feet apart. And for the male client, it should be in a supine position with legs slightly abducted. So assuming that my client is already in a dorsal recumbent position and feet about 2 feet apart, I will now start cleaning the genital and the perineal area using soap and water. So after that, I will rinse it and dry and perform hand washing again. So assuming that I've already done the perineal care, I will perform hand washing or hand hygiene. And I will now prepare or open my sterile catheterization kit. So it is already open. And then I will now, it is important that when we open the sterile catheterization kit, it should be in a sterile table using a sterile technique. So I've already opened it. So I will now put on my sterile gloves. Now that I have put on my sterile gloves, I will now be removing the packaging, and I will place on the sterile or the fenestrated drape over the genital and perineal area of my client, draping it above my client's thigh. Now that it is done, I placing the sterile tray over the drape between my client's thigh. And then I will open all the supplies. So we will check the catheter. So first we will check the balloon of the catheter if it is inflating properly. So we will have here the syringe refilled with sterile water. So we will remove the cap of the tip of the syringe and we will insert it to the injection port. And we will run a small amount of solution or the appropriate amount of solution to check if there are or if the balloon is inflating properly. We will check. So it's inflating properly. So if it inflates properly, then we will withdraw the solution and we will leave the syringe attached to the injection port for it to be ready. So after checking if the balloon of the catheter is appropriately inflating, we will pour an antiseptic solution to the cotton balls. So assuming that this is an antiseptic solution, we will pour it. And then we will also lubricate the tip of the catheter about 1 to 2 inches. This is to promote or to help us insert the tip of the catheter smoothly and easily. Now I will proceed to the catheterization of the female. So first, using the thumb and 1 finger of my non-dominant hand, I will be spreading the labia and identify the meatus. And I will keep or stay spreading the labia until the urine flows well and continuously. So let me just spread it. So now that it is spread, I will, using a cotton balls held with a forceps, I will clean both labial folds and directly into the meatus. So for the meatus, we will start cleaning above the meatus downwards to the rectum. And also, we will discard every cotton balls we use every 1 downward stroke. So first, we will start on the farthest area. So 1, and then we will discard. And then 2, we will then discard. And then 3, down to the meatus, down to the rectum, and then discard. Now that we are already done cleaning, we will now insert the tip of the catheter into the meatus for about 2 to 3 inches. So we should always remember that we should not use force to push the catheter through the urethra into the bladder. Instead, we will ask the client to take a deep breath and rotate the catheter gently if slight resistance is encountered once the catheter is or reaches the external sphincter. So, ma'am, I want you to take a deep breath. I will now be inserting the catheter. Okay, ma'am, 1, 2, 3. So we will insert it until the we can see a urine flows, and if there is already a urine drainage, we will advance again to about 1 to 2 inches since we are using indwelling catheter. Now that it is done, we will now check or we will now inflate the balloon of the catheter using based on the manufacturer's recommendation, usually 5 ml. So we will inflate it. then we will remove the syringe and we will tug the catheter gently to check if there or to feel the resistance. So it is already good. Then after that we will now secure the catheter and the tubings up on the upper thigh using a velcro strap or a tape, and we will leave some slack in the catheter to allow leg movement. And then also we will be checking the drainage tubing if it is not kinked, and whether the movement of the side rails will interfere with the drainage bag and the catheter. So after that, after making sure that the catheter and the drainage bag is secured and will not be interfered with any movements, we will hang the drainage bag below the bed of the bed. So assuming I already hang it up. And then we will keep our client comfortable, and after that we will clean all the equipment and make the keep the client dry and clean. So now that I'm already done with female catheterization, I will now proceed on performing the male catheterization. So assuming that we've done all the first procedure, I will now lift the penis and using my non-dominant hand, which is already considered as contaminated, and then using a clean cotton balls with or held by the forceps, I will be cleaning the area at the meatus. So I will start from the meatus downward to the base of the penis for 3 cleansing. So let me start it. I will use a circular motion and then I will discard it. And then the other one. Discard it. And for the last one. And then we will discard it. Now that I'm already done cleaning the meatus, I will be positioning the penis on an upward position with a little tension and perpendicular to the client's body. And then I will be lubricating the tip of the catheter. And then I will insert the tip of the meatus into the I will insert the catheter rather into the meatus. So I will advance it for about 6 to 8 inches since it is an indwelling catheter. So take a deep breath, sir. And then we will rotate the catheter gently if resistance or slight resistance is encountered. So once the catheter is already in, I will now be inflating the balloon of the catheter to avoid it or and then I will tug it gently to feel resistance so it is good. And then after that, I will now secure the catheter and the drainage bag tubing on the upper thigh of my client again, and using a velcro strap or a tape, and I will leave some slack in the catheter to allow for leg movement. Also, I will be checking if the drainage tubing is not kinked and if the movement of the side rails will not interfere with the drainage bag and the catheter. So after checking all of that and securing that it is all good, I will now hang the drainage bag below the bed of the bed as well. So after that, we will now remove all the equipments we used. So once we already removed all the equipments, we will make sure that the client is clean and dry, and the bed as well, and we will make the patient comfortable. So we will put on some blanket, and then after that I will now make sure that the equipments are properly backed in the storage or disposed and cleaned, And then I will now remove my gloves and perform hand washing and hand hygiene. And then after that, we will now proceed to the documentation and evaluation, in which I will be documenting the time the catheterization was done, the amount of urine removed, and the description of the urine. I will also be documenting the reaction of the patient to the procedure and the mining. So that's all for the catheterization of female and male in urinary bladder using an indwelling Foley catheter. Thank you.